Now the tables, you can sit at a table that you have any particular interest in, education, for example, human rights, or you can sit at the global table, the global health table, or there's an other table. So we're going to do a breakout at the end that is related, we're going to talk about things related to your interest area. So that's why these tables are set up like that. So feel free to move around if you'd like. I want to talk to other people that have the same kind of interests and passions that you have. So now we're going to get started. A couple of things before we get started. Please silence your cell phones. We're going to have a report out at the end. There'll be a microphone coming around because it's such a large room. Wait for the mic. And after the session, please fill out the short survey that's right before you on the table. My name is Jeff Walker. I am really happy to be here and connect with you all on the topic of systems change. It's something I've done a lot of research on and work in and collaborative discussions around. I don't like being up here, how about that? I'm an old private equity guy that turned good 10 years ago and started working in social change, teaching some at Harvard Kennedy School and the business school, and being involved in global health, work on community health worker strategies with a number of you that are in the room, worked on the malaria effort. These large problems are areas of interest to me. But also, they're interesting because it allows and requires, in my experience, collaboration. People coming together because no one organization can affect the change that we all need. I'm a music freak, and so a lot of my analogies are related to playing music together, being a jazz player in the old days. How do we listen to other players so that we can create our own even better sounds? How do we produce a sound as a group? And then how do we remember there's an audience, or that there's an impact? And so that process for me, I get goosebumps when I talk about it. You know, it's like, that to me moves me. And this collaborative process and finding these opportunities and finding ways to connect people together for these larger scale changes is really what moves me. So I want you to, for 1 second, get the feeling of working together. So I want you to hum together when I raise my hand and lower it for just a second. Cool, right? We did something together. We've accomplished something. That's a system change. That's all. It's that feeling of flow, working together. So we've done a lot of research on this one, and this question of systems change and how we do this. And so I'm going to walk you through, for the first 20 minutes, a few slides on kind of what we've discovered at the Kennedy School and some work we're doing, what I tend to write about. I have an article that just came out literally today in SSIR about systems change and the big, focusing on the big problems of the world. Love to have your thoughts and comments on that. It's a topic that's gone from the consultant world, the FSGs and the bridge spans and collective impact world, to now the application. How do we translate this to the large-scale changes that we all want to work on? And so we've been putting together cases. We brought together last June 30 different systems change organizations or funders of those. System incubators is actually organizations that fund incubation of systems change. So we'll talk to you a little bit about those. And we started saying, what is in common with all of those? What are we thinking about when we're thinking about systems change? As a funder's viewpoint, as a nonprofit's viewpoint, as a government, as a multilateral. And so the topic is coming up. I've taught at Aspen last week. I helped teach at the school, at the Schwab Fellows meetings at Harvard. 8 days where the average experience of the social entrepreneurs at that meeting was 15 years. Many social entrepreneurs are being frustrated about, gee, I can't scale within my own organization. How do I think about this? or frustrated that my board doesn't get it, or frustrated that the donors aren't funding me to do that work. And I think that's really important. And so you're saying, oh, okay, well, maybe doing more cases about this, sharing knowledge with funders and others, and collaborating is potentially an effective idea. So you cannot read this slide, and you're not meant to read this slide, but it helps me kind of like follow the process. But it shows you that there's complexity. So each of these system change things that we're working on, it's not easy. So finding others to do this, Nick Rono, who leads the Freedom Fund, is over there, and we talked about, you want to do this with people you like. You want to do this with people that you can work with, because this is a long trip. This isn't like, gee, I'm just going to take one idea and we're going to scale it and it'll all be done. This is my own private equity days. This is what we used to do. You know, we funded the early startup of something called Office Depot, which eventually grew into a competitor to Staples, and they owned the office supply business because they went public, and it was all straight and pretty easy when you look back. That's obviously not the case in the social change world. So the first thing that usually the successful systems change groups have done is say, what's the problem? You don't jump to the answer, right? So many of us as philanthropists kind of look at, what's the new great NGO that has all the answers? We're going to get, in 20 minutes, or 15 minutes or so now, Ellen Egger and Raj Punjabi up here. And so many people will say, well, they're the answer. Now I'm done. No, that's not even close. What's the problem you want to solve, and do they agree with the problem that you're going to solve? And is the group that you're talking to, working with, agree on the solution? And malaria, when we worked on malaria, it took us a year to get from 660 organizations that were looking at malaria in a White House conference and working at Gates to come up with 30 organizations that really wanted to work together for this large-scale change. And to agree on the fact that it's deaths from malaria and using bed nets to do that, to prevent deaths from malaria. It took a while. So what was the problem came before what was the answer. And then two, this is a system map. And if you're interested in how to do system maps, if you haven't done one before, you don't have to do a great PowerPoint. Hell, I just list out people in the system. But who cares about the same problem that you care about? Do the system map before you try to come up with the answer. At DRK, they're talking about looking at system mapping as a requirement before they will fund a social entrepreneur. Because if the social entrepreneur doesn't understand who cares about the same problem, what's the point? The person clearly is isolated. So at least think about this one. So going around saying, who are key influencers? Who are relevant assets that I can maybe use? In malaria, we found that Exxon was going to be a great partner. In the 25 years before us, no one had ever talked to Exxon. Turns out their employees were exposed, their communities were exposed. They became our largest corporate funder. Without doing this whiteboard mapping, it's actually kind of fun. So you go to other donors, you go to other NGOs, and you say, what have I missed? Here's kind of what my whiteboard looks like. Is there somebody I haven't talked to that I really should? Or some resource that I really ought to come together with? And this is governments, this is corporations, this is multilateral. It's not just the old world malaria. We all just talked about healthcare experts. That's all we talked to. Like, no wonder we didn't kind of understand the impact that's possible. Going to convenings, and so doing the whiteboarding solutions or having dinners with other people is also another really fun and interesting experience, but something that people don't always do. And so do that before you're coming up with the answers. Ingo Stahl's right back here. She convened all of the different nonprofits that are in the community health worker space and saying, we just need to talk to each other. And brought multiple funders in the same room and said, what do we have in common? What are the issues we have? And what can't you do as NGOs by yourselves that together we can do in a larger system impact way? So it's a good use for a funder to help convene and bring these ideas together. And then lastly, figuring out what's the objective. What are we trying to go after? Some common measurable outcomes. Hopefully simple ones. At New Profit, we scale social enterprises, but we also now, in the last 5 or 6 years, take a systems viewpoint. We have 7 different ones. One of those is around skill-based employment. In the United States, there are 10 million individuals between the ages of 18 and 25 that are underemployed, flipping burgers at McDonald's, that we want to take to another level to get out of poverty. Looks like, it turns out, there's not enough innovation in that field yet. Because it's not all about getting people tech jobs. It's about going into healthcare, it's about going into other solutions. And so they said, let's do an X Prize. So we're going to do an X Prize. We have Walmart Foundation. We have Starbucks Foundation. We have 12 foundations all coming together saying, you're right. We haven't figured out the solutions yet that we really want to support. So let's go be creative. Let's come together. And so New Profit is that system change agent said, let's go do that, and a little more innovation, because we haven't figured out what to scale yet. And so then we break down systems change into 6 categories. The typical social entrepreneur, who is awesome, is an innovator. Comes up with great ideas and tests them and develops their tools and techniques to bring their ideas out to the world. And we love funding those, and we should continue to fund those. But understanding what you are as an organization is really important. You may be an innovator that just innovates. I've been on boards of nonprofits, and we tortured our CEO to scale. And they didn't know how to do it. They weren't really meant to do it. But we said, we have to. That's the way we did it. That's what the venture capital business does. We take things to scale. And so we're going to have to fire you, and we're going to have to bring in somebody else. And you say, well, wait a minute. Maybe that person's a really good scaler. Really good innovator. Maybe that's okay. In fact, I would assert 80% of social entrepreneurs are really good innovators, and let's let them do that. But there's also some other things that have to happen to think about that larger system-wide question. There has to be research. Who's going to look at all the different innovations and figure out that one works, this one doesn't work? But these 3 together, AIDS was 3 drugs that came together, not 1. So who figures that out? Well, researchers spend some time doing that. That's clearly universities, consulting firms, a variety of other people, and funders can fund this, who are going to help you analyze that and help analyze how it all can come together. Again, in the CHW space, there's a group called CHW 15 that now is sitting there going, what do we have in common? What are the innovations that we want to bring out to the world, that we want to bring to WHO? Because WHO is more likely to talk to us if we are talking as a team in a group. And when we're going to a health minister, instead of saying, here's 100 different ideas that you as a health minister and 100 different NGOs that are all sitting there going, we have the best idea. What if you had somebody sitting there going, we actually worked together and figured this out, and here's what we want to bring to you, health minister. And we're going to actually help you talk to your finance minister about those questions. And we'll do this in a more thoughtful way. In the United States, that's the same thing. Every school system has 1,000 nonprofits who have the better idea about how to run education. And so the principals and the superintendents are going, I can't do this. I just can't listen to all of this. And so how do you find somebody who can translate that? Research is part of it. Communication and awareness. How do you make people aware of innovations? In malaria, we actually brought awareness to malaria from 23% in the United States over a 2-year period to over 70%. People knew what a malaria was. We worked with a guy named Peter Chernin, who was running American Idol. We brought it out there. We did nothing but nets. So you're like, okay, well that seems easy. Well, it wasn't easy. It was years into the process when we were building our networks, and we finally figured out there are people who will work with us. And he was doing communications awareness. No nonprofit could have ever done what he did. And so he set up Malaria No More to do that. It was a single purpose entity to build awareness and communication around that topic. Policy change. I don't know one nonprofit by itself who is very good at policy change. Working with governments to try to figure out how to change laws, how to influence the political process to support them, setting up AmeriCorps programs if you're, for example, in the States and looking to find talent, Teach for America and a variety of others. America Forward, which is under New Profit, has 80 organizations that are joined together to influence the political process. And so they're sharing those resources. And so the boards who've been torturing the CEOs to say, you've got to get active because you have to protect the AmeriCorps program. Well, we are, but we're not doing it by ourselves, because that's less important. It's not less important, it's less effective. So there's single purpose entities doing that. Measurement. There's not enough data being sourced by honest brokers. With honest sources of data that you can measure how you're doing. And without some common measurable outcomes, you will not have a collaboration that works. What are you all working together, and how do you measure that along the way? Chris Murray and the University of Washington is funded by Gates, 300 individuals who measure maternal and child health around the world. Major input in all of the work that where Gates is funding, but not just Gates. It's how UNICEF evaluates itself. It's how we all look at activities under the UN, but also on any other global health strategies. Chris is an open resource for us. We did this on malaria, set up ALMA, which is African Leaders Malaria Alliance. Sharing data by country so that every 4 months we sit with the African ministers and the presidents and prime ministers at the African Union meetings. And we have one woman who runs this organization, and now we've moved the last 2 years, the organization under the African Union. It's not ours anymore. It's the African Union's. And you can go online and look up on ALMA and see a red, green, and yellow heat map as to how we're doing by country. How the malaria issues are popping up. And we need this almost in every area. In my music space, we have one that tracks by school, number of music directors, number of kids taking different programs. And until we have that resource, we couldn't unify the 70 organizations that are working on bringing music back to all kids across America. We didn't have the resource. And we empowered then the next group, which is integrating the innovation, which is we empowered the people who were running the music programs in the district schools so that they could start saying, you're working with us to achieve a common goal rather than you just telling us what we need to do. We're empowering the health ministers because we're giving them information and data that they can use to evaluate how do we bring in community health worker systems. How many do I need? How do I finance it? So you're not just telling me, just give you all of the things that you want. You'll do it for me. It's actually empowering them to do it for themselves. And so these are the 6 things that we tend to see. And if you're looking at a system change and you don't see people in these categories, maybe you ought to fund some. And if you're a social entrepreneur and you think you need to do all of these, you're crazy. That you ought to really start figuring out how to delegate that. How many people here call themselves social entrepreneurs? How many are funders? How many are system entrepreneurs? Cool. So here's how I think about it. System entrepreneurs and social entrepreneurs. They're natural partners. You need them both. So it's not an either or. But you don't necessarily look at social entrepreneurs and say, I just need to identify a social entrepreneur and upskill. And all I need to do is find the best and the greatest social entrepreneur. And so I'm going to figure out whether it's last mile health, or it's purpose, or it's living goods, or it's Muso. Come on, are you kidding me? Each one has something useful to offer, but isn't necessarily going to be the answer. And the health ministers don't want to hear one answer. They want to have a set of tools. You know, that works over here, that works over here, and so Ethiopia is going to be a government-led system, and Uganda is going to be a blended system with their, whatever. So who brings that together? That's what a system entrepreneur does. A system entrepreneur has a different skill base. You can be a social entrepreneur and become a system entrepreneur. Jordan Caslow's a great example of that one, where he had, for years, run a great organization called Vision Spring, which is bringing eyeglasses to the world. But Jordan, I'm speaking for you, and we can talk later, but you know, it's like, this is frustrating because I want to get to the billions, not the millions, right? And so we set up the Eye Alliance. And that's being incubated. It was incubated at Geneva Global, if I remember correctly, but also now at Tides Foundation, saying, how do I grow this? And so finding places that will allow you to incubate your idea is a high value opportunity. So Doug Balfour at Geneva Global has done that in conjunction, in partnership with Nick Grotto, Freedom Fund, the Godin Institute, set up the N Fund, Ellen Agler you're going to hear from in a second, Speed Schools, and a variety of others. And so he's a place, and we've given him something else that he's working on for us. But how do I be the backbone that allows multiple funders to come together to bring these ideas? Tides Foundation is doing that in San Francisco. We're doing a new profit. We're setting up a new democracy fund, for example, that many people are coming around. And now Pew Foundation has done 25 of them. The oldest one's in the ocean space, Ocean's Legacy, where they have protected millions of miles of the ocean from trawler fishing. There are 6 philanthropists that got together, hired scientists in common, and worked as a team to accomplish that. And both Obama and George W. Bush signed into law these millions of miles of square ocean, and they were the key influencer to that process. So we need, as philanthropists, I do it all the time. I will back somebody. I have 2 individuals that work with me in the community health worker space who full-time do nothing but think about connecting other people together, evaluating data, trying to find those levers in the system that we need to pull or fund. We set up the Financing Alliance, which says we need to help health ministers figure out how to finance their health system. So let's get Credit Suisse, we got Rockefeller Foundation, we got GSK, and others funding this because they all agreed that that was a key important point. We did something called M for Health, where you're sitting going, we need to actually put talent in the ministries because the average health minister is in office in 1.2 years. And they're doctors, so they've got no management experience. So what if we embedded talent for 2 years that are mid-career, and what if they're Africans who are going to stay in Africa doing the work, and they're connecting multiple countries together to share knowledge around community health workers, and they're leveraging off the CHW15 effort because they're hearing all these innovations from the social entrepreneurs. Isn't that a really interesting role? And so English actually paid for an individual to hold that all together around the CHW15 space. There's backbone organizations, there's ways to start these up, but bottom line is start talking with each other. Start finding others that have common passions. In a second after our discussion, that's what I hope you all will start to continue, or will continue to do, is find others passionate about a common area of interest. Figure out how to do something small together. And I'm going to challenge you after our discussion to say, what are 2 things in your area that if you had to look at the system, if we invested in it or if we did, and if we wrote about it and if Skoll took time to think about it more deeply, what do we want to communicate that are important to think about related to the system change space? So I had more fun doing this and building our ensembles for change because that's what we're doing. We're connecting to others and leveraging off of this. And I think it's probably the only way you're going to go after the big issues of the day. So now we're going to go, if I can ask Ellen and Raj to come up, and I'm going to ask them a few questions about this because I would say Raj is in the space of moving as a social entrepreneur while continuing to have a direct service operation, last mile health, but also very concerned about the system-wide space. And he's becoming, because he's been the Skoll Award winner and the TED Award winner and the Schwab Award winner, and he's a hot property, but he's got a managed ego that allows him to.
On speaker.
Right? And just learned he's going to have a daughter soon. So that's all good news. And then Ellen Agler, a great friend, but also one of the best system entrepreneurs I've ever run across, which says, she wasn't a social entrepreneur. She was in the health space, but she said, I'm really good at holding people together. I'm really good about connecting. Well, maybe Gene may not think that, but everybody else does. Saying, you know, here's someone who can hold this conversation about ending neglected diseases and unify them. And she, and I continue to brag about this because she's probably online, where she at the Gates Foundation annual meeting was the only outsider to speak to 3,000 people. And she spoke between Bill Gates and Warren Buffett. And she held a bucket of worms as an example of one of the diseases that we can prevent, right? So fun. So, thank you guys. Thank you for spending the time. So, I embarrassed you?
I'm kidding.
So it's fun to partner, right?
Yeah.
Just per se. Hanging out and talking about tough topics and finding others to share that experience with. So how would you define system change, you know, from your own perspective?
Well, first of all, hi everybody, and there's like so much wisdom in this room, and I know Jeff's eager to get all of you involved in this conversation. How I define system change, I was thinking about this, and I think about this in like a three-dimensional way: skills, time application, work values, and how your organization, if you're a social entrepreneur, how you spend time, if you're thinking whether you're a systems entrepreneur or a social entrepreneur, or a social entrepreneur that focuses on systems change, I think the ones who either are systems entrepreneurs or social entrepreneurs like us that are concerned about systems change, the kind of skills in addition to the ones that you normally would have as a social entrepreneur, I believe negotiation should be added on to that. Then someone who's able to prioritize shared interest over individual positions, or sometimes getting deeper below the positions that are there. I think the other skills that matter obviously are diplomacy, advocacy. Those are some of the ones that come to mind. In terms of time applications, and we've struggled with this, you know, we're not, the metrics for systems change when we've gotten involved with I see everybody, you guys should come sit up here, Ari, but I see Musso and our friends Hope Through Health in the corner in English, and you know, we're all part of this consortium in community health, and I know there are a few others in the room, but that, you know, none of us are staffed to do that. Our boards don't staff us that way, our funders don't pay for our staff that way, but we've still all prioritized staff time to do that. So I think that's another, in terms of time applications, you're a social enterprise or nonprofit social entrepreneur that's willing to allocate your own time and or your staff time towards helping the collective, even if that's a long-term, and not necessarily short-term gain for your four walls of your organization. Spend time on
I call that a managed ego.
Yeah.
To have the ability to say, there's higher priority.
Yeah, that's right. And I think you're then spending time on advocacy that's promoting the cause, not necessarily promoting your own organization, and that's something you deliberately seek time to do. And then just two things on values, which one of you just mentioned, managed ego. I think the humility to do work that others may not do, and then later on give an example of how that happened during Ebola for us. And then the other ones is just, again, the same thing, values the success of the cause over the success of your organization. There's a mantra we have at Last Mile Health that we're much more interested in lowercase last mile health succeeding. The idea that we should get healthcare to everyone everywhere, that's not our idea, it's shared by a lot of people, over the success of capital LMH. It sounds like heretic to anybody that's running a company, but we see ourselves as a means to that greater end, and that means we need to also be successful. But it's lowercase LMH first over capital LMH. And then the last thing in terms of in terms of work values, is, you know, if credit and attention is given, as much as you can to redirect that attention to the cause. I think that's really another piece of it. And actually that's hard to do, I would argue, we can get into that later, because I don't think the incentive structure here is set up that way.
Here at school?
Not at school, but I think, I just think, you know, there's such a, entrepreneurship comes from a history that is actually very strong of individual empowerment, that's individualistic, yet everything we all do in systems change is collective-based, and it comes from philosophy of collectivism. So somehow we've just taken that social history and it's normalized us to think we celebrate individual heroes or individual organizations that are heroes, and there's nothing wrong with empowering and celebrating success. I just wish there was also you know, a chance to celebrate collectives and teams. I don't know what award exists for systems initiatives.
You got one.
Yeah, well, but
Do you think you were being celebrated for systems change?
I think
as
we
much?
were, but I don't think
Why?
that's the way we were. Yeah, when we
I'd love to hear the school team who evaluated to figure that one out, but I'm feeling like there is some change.
But there's so much there's so many great systems initiatives, right, that are out there that I just don't see where are the awards for the whole group of those. It's just an example of like, you know, where people put money is where there's one place that recognize what they value, and I think we've just borrowed that entrepreneurship, which has been good for the sector, but also I think we're not thinking about how that impacts or disincentivizes collective collaboration. So those are the three things: skills, time, application, work values that help me make a little more three-dimensional shape of what a systems entrepreneurship might look like versus social work.
So do you think you're a system entrepreneur, Ellen? And does it fit?
Me, I am. So
All right.
I'm trying to embrace that. I'm just really excited to be here. So great to look out and see so many friends and partners. And I think when I was here, I was kind of having this, I've been called Farmer for a while, and just seeing like his dynamic with Jim Kim this week and how long they've been friends and how much joy and how much tears. And I don't know about you guys, but I feel like I've had a lot of laughter and tears the last couple days here at school. And thinking, I really want to have that someday. And I'm like, I get to be on a panel with Raj and Jeff. What do you mean I do have it? And this, like, the warmth and appreciation that I feel for getting to accompany each other and so many of us together through this work, I think that is part of systems change, is relationships and being in authentic relationships over a long time, and being able to reach out for help. And you know, collaboration is messy and complicated, and I love that Atul said, you know, the problem is the humans in the middle. that's the problem, and that's the door that we walk through, and the opportunity. So for me, I think it's interesting that a lot of the community here are, and I worked in direct service organizations for a long, long time in global health, that had trouble collaborating and trouble thinking about a systems view. They really had a very strong sort of founders culture and an individual way of doing things, and it was very hard for me, who's kind of a natural collaborator, to be in organizations that didn't see things on a systems level. So when the N Fund came, when Doug Balfour from Geneva Global and Legatum came sort of and found me for this role, I thought, wow, the problem is so big. People have to collaborate in this space. It's 1.5 billion people have the 5 neglected diseases that we're trying to end in the coming decade. And if that's going to be possible, it's got to be a lot of people that come together in a pretty coordinated way. So that motivated to me. And I think what's interesting about the N Fund model that I was attracted to was that it was designed with systems change in mind from the onset. It isn't necessarily a direct service organization scaling to be a system entrepreneur. It was designed from the onset to be a sort of systems lens and to look across the entire space of who's working in the neglected disease space, from small implementing partners. I mean, we're working with some small local NGOs to really large NGOs to funding directly ministries of health to what's the agency inside of WHO, the World Health Organization, that needs to be stronger in order to support this globally, and be that lens to see the whole space. And so I think it was an organization started with the systems map in mind. And some of our initial founders and funders that had spent a lot of time working in Africa and funding projects, they sort of said, we don't need any more boots on the ground. There's so many great organizations and great people. How can we be the glue between those things? And how can we help inject ideas or capital or technical assistance in places that could scale up so that we could rise the whole, sort of all the organization. And I also sit on a sort of a backbone organization on the board called Uniting to Combat NTDs, and there's about 100 or so organizations coming together, and we were talking about prizes for them. We're getting together in a couple of weeks, and somehow, like, I don't know how Guinness found out about this, but they're now bringing the Guinness Book of World Records prize for the largest, like, drug delivery program, because this year we've reached, the data just came in from 2016, and as a collective community, we'll have reached 980 million people with treatments last year. And I'm really proud because the N Fund, we've we've supported about 26 organizations to treat 100 million people in that space, but also it's our efforts, which is incredible, but it's also our efforts beyond that to partner with the whole range of organizations and figure out what can we do together around policy and advocacy and broadening the tent. I think that 5 years ago when I started, we realized, okay, I mean, I sort of, I was hired to solve a lot of problems. I kind of looked around, I was like, I don't think the smartest people are in the room yet. I think we've got a lot of figuring out what are the on-ramps to this space. And when I would bring maybe a new donor to the space, they would say, gosh, I don't speak NTD, this is very complicated. All these names have very long, long, complicated, unpronounceable, but how do we lower those barriers to bring others in a way that they can feel effective? So a lot of the partners that we've supported are not traditional actors in the space. We've brought NGOs that have never worked. I've seen Jacques Savisaho here and met a few years ago, works in the Eastern Congo, didn't even realize that NTDs were such a big part of the problem there until we started looking at mapping. It's like, oh my gosh, 90% of the people in the population I serve have these problems. How could we work together to ensure that that population has access? Or some of the malaria organizations now that may have worked with a mosquito vector but not on NTDs. How can we provide technical assistance to them? And we've done a lot of working with governments just to help, what do we need to do to help support a national plan for creating, ending these diseases and bringing together a coalition at a national level of partners that need to coordinate.
So how do you both look at talking to your boards about the system question? Do they all get it? Or how are you talking to them about funding? And I know you went to Gates, for example, and got significant funding for communication awareness. Not for any nonprofit. It's kind of like, no, we just know we need to do that, right? So how do you talk to your own boards, and then how do you find donors who get it too?
Well, I think because our organization was started with the systems lens, they do get it. I think that it's interesting though, because there's still a tension we're bringing in. I always think like, wow, if all of us sat around a table and talked about politics, no one would get along, but everyone gets along because of the belief that we can end these diseases. And so there are people who would prefer to fund all community-based organizations to solve this effort versus all sort of academic research. And finding that tension and balance, I think, is what's interesting. We've spent a lot of time, there was a group of Western philanthropists primarily that started the N Fund. And more we've been trying to engage. We've got a great African philanthropist on our board now who's really helping bring on board more African philanthropists and corporate leaders. So it's not that systems change is so controversial. It's just how to prioritize and what to do first.
Well, they're still learning, in my experience with them, right? Yeah. They started out as, it'll be a fund of funds almost, like we'll just do the smartest allocations. And they say, well, wait a minute, that just doesn't work, right? And you had to educate them.
Well, it's interesting because I think there's a lot of confusion. Even the name is like end fund, as if we're only a funder or we're an endowed organization. Like, not really. We're aggregating capital from a lot of different philanthropists and sources and trying to do joint granting. And I think one of the things that the ministries of health have said over and over, like, oh, we so appreciate that you're kind of like the one-stop shop. And fund comes, you know what the other major funders are doing, but you're actually coordinating maybe 50 different philanthropists rather than us needing to have 50 more visits to the Ministry of Health. But yeah, it's a learning journey. I think that we've come a long way in figuring out how to do it well and realizing, yeah, we're not just a funder. Now we have much more of a technical assistance team that really has a deep knowledge. We've hired people from implementing organizations that are a wide range of them in this space to kind of be in-house and help design programs. We do a lot more advocacy and policy work than we thought we were going to do at the beginning.
Yeah,
your board just got it?
I'm lucky because I have a board member in the room, Ken Keller in the back, so you can keep me honest, Ken. But I think that, yes, I mean, we were born from the Ministry of Health. I mean, we literally started the organization because the Ministry of Health didn't have the funds to pay community health workers. We didn't have a business plan. We just raised money from grassroots, and then we, the first R&D project we ever did, we went to the Minister of Health and asked her to not just tell us what problems she wanted to solve, but actually literally ask her what 3 policy questions does she have that she needs a demonstration project for. I thought we were doing I knew she would give great ideas. What I didn't realize, as unexpected, was that they would actually give us one of the core innovations, which was to put a clinical nurse in our case, a really excellent coach, to coach these community health workers. So she completely reshaped what we did. So I'm giving a couple of that backstory because it was part of our DNA, part of our culture. So the board members we recruited always were people that had that background. But I think now when we talk about it, Kim, in the boardroom, it's after getting off the hum in the back with that big noisy vent in the room in between the board meetings. I think we always come back to what we're first started to do, which is serve the patient. So we're always interested in leverage that increases the ability to reach more patients or increase the quality of care for patients. And so we've always argued from that perspective. Why are we working with the government of Liberia? Because the government of Liberia, Partners in Health, as he can hear, and a number of other actors are interested in the same thing around trying to professionalize community health workers in these remote rural areas in Liberia. We all want that opportunity. We're not going to get a chance to do that if all of us are doing different things, because the government of Liberia, we've all given our leadership support to them. They've been able to then take the sum of our efforts for the whole country and be able to crowdsource in more funding, but actually, get in more public sector dollars, which has made all of us more capable of being able to reach more patients. So I think it's always been from a leverage point, coming back to the original mission, which is to save lives in remote communities. And I don't know if that'd be different from a systems entrepreneurship standpoint, how you would argue it in a boardroom, but for us, it's if it fits the lever.
But having a bigger goal, I keep hearing from a couple of sources that in the end, to be a system change agent, I need to leave my direct service operation. That you might be like a Jordan who did that. Say Europe is now spinning out their system change group because they're finding that other NGOs didn't trust them. That they were going to be the ones getting credit or the ones getting the funding from all the donors. Honestly, I have heard other donors saying, I'm not giving it to Last Mile Health because they're the hot one. I need to find other ones.
Yeah.
You say, well, wait a minute, they may actually have a really good answer, but I'm not doing that.
Yeah.
So there's this conflict.
I think there is. I think at the country level, for those of us that are interested in helping the public sector succeed, it's a little easier, I've found, because we're trying to help the government succeed. It's not the Last Mile Health model that's scaling, it's the National Community Health Assistant Program that each of the different NGO partners have helped shape and inform. The curriculum in that program is the HIV/TB curriculum is the one that Partners in Health developed in Haiti and Rwanda. The IRC put the family planning curriculum in. But I think that backbone organization is essentially the government for the most part in that situation. I think when you get to the global level, I know Ari and Mark and others are here in that CHW15, the group that English pulled together. I do think there's that inherent tension. I think it's very hard when you're sitting there saying, let's all do something as a collective. But when we go back into our boardrooms to our staff, we have to worry about making sure we serve patients in Mali and in Togo and in Nepal. And that's our first mission, and that's actually what Systems Change wants. We need good examples of programs on the ground. But then what? How do you help get to that? Is it, words like umbrella organization get used, and I just don't know what that means. Consortium gets used, I don't know what that means. And we look to you, Jeff, and others who've really studied and are studying the science of collaboration to tell us what are the effective ways to do that. You've done that with NFund. So I think that's a real struggle. I think it's a real struggle.
So before we go out and have you all start talking across around the tables, one last question. So where are we going with this? Where would you say are there things that we should be spending time thinking about if we're trying to go after the big problems of the day? You all in your particular areas of expertise, but also maybe stepping back and advising the school community. Here's some things to work on.
Start. I think if your school or your forum like that is trying to, part of your job and part of what you do is you shape the culture of each of us. You shape the norms of what the community does. I think part of the task there is to shape the values, to shift it from being four-wall focused, capital, first time I ever heard that was from Paul, right? Capital partners in health, but there's a mantra, lowercase partners. Let's shift the capitals of each of our organizations to the lowercase version, go from org to cause. I think that's a values orientation. People like you who are esteemed saying managed ego leaders, I mean, those are things that are valuable. I think that's one. So if you're a philanthropist or an investor, I think finding ways like English is trying to do and Bonnie's trying to do to invest the time and the capital to create a collaboration is really important. And maybe at that point, I don't know if you would say English, but I think it's still early how to do that even as a philanthropist. So perhaps sharing some best practices there or what's worked, what hasn't would be useful. And then I think if you're an entrepreneur, to me, one big thing that we can all do is, boy, would I love to figure out what metrics Jordan is using at the Eye Alliance and figuring out how our KPIs at Last Mile Health could in some way be, if we could find a way to judge our success in a way that is contributing to the success of the collective, and that's metrics partly, I think that would help rationalize some of the way the investments and the time is spent. I don't know how to do it, but I think
it's a huge opportunity.
Yeah.
To think about measurement data, because we're just beginning to figure that out.
Yeah.
To work on systems level data measurement, kind of what we're doing.
I think probably in the health space, there are so many examples of good coalitions. And, whether it's malaria or TB or, the InFund is one model, but we also work with other coalitions that you sort of put your logo aside and work underneath a broad umbrella, and that actually helps so much with moving an agenda forward. I also think that this tension between social entrepreneurs and system entrepreneurs, I feel like it's a lot of pressure for social entrepreneurs, and I worry about losing the quality of just great implementations. And if not, just that point about not everybody has to become a systems entrepreneur, and actually systems level leadership and how to run coalitions well, how to manage backbone organizations. That's actually a full-time job with a different set of managerial expectations, and I feel like sometimes I get a little bit of like, oh, you're only doing systems level work. You guys are not actually direct implementers, which is like, that's the golden thing, to be an implementing organization and doing this. I think, well, this is a really complicated full-time job, having a team of people mapping the hundreds of organizations and thousands of different partners who are working in this space and figuring out what needs to get done to move the whole space forward. Why is that also not, you're right, why is there not a prize for that, or why is there not and it's not like we need prizes, but that feels to me like a whole area of study that does have its own science and its own training programs, and I think that is what you're leaning on. And I think that it's amazing to me, what I've always seen, Jeff, with the way that you've supported organizations, is sometimes it's not that much funding to put the glue in place, to help the coalition come together, to just create the one person that can kind of pull everyone together, or a little bit of funding for that. And I've seen you influence so many other funders for that. So I think it's happening little by little, but all of us that are committed to that sort of systems change approach, it's not systems change in a very ethereal way, it's very practical.
Going to a donor and getting commitment, and donors, and I actually advise donors, getting a commitment for funding one or two people who are going to hold us all together as NGOs doing things that we have a hard time doing separately. It's cheap and it's high leverage, and it will get you more funding. Like doing this and walking into a donor, I said, wait a minute, you figured out how to work together? I'm funding you, right? As opposed to I got to figure it out myself.
pay for glue.
A little bit. It doesn't take a lot, right? So we're going to go to tables for 15 minutes, and there's going to be people, I think there are people at all the tables, if not, so Doug is going to be the moderator here, Nick over here, Jordan over here. Can you raise your hand if you want to volunteer to be, Amy, you're going to be on that table, maybe? Thank you. Corner table, raise your hand, whoever wants to be the documenter of what you guys are talking about. Thank you. English, you're the one over here. Environment, who wants to be, raise your hand. You're it. Okay? And this table, you can either be your own table or you can work with other table. It's up to you how you want to work that. So again, the goal is 2 things in the space that you think we ought to focus on going forward as system-oriented individuals, and when we want to communicate to the school community, and we will write about this, and we will spend time on this. And you'll report back those 2 items, and you get 15 minutes. Okay, so now we're going to go to some quick report backs. And we're going to
have to dry run it publicly.
And we're going to keep track of your comments. We have a microphone that's going to be coming around. So can we start at this table on education? So Doug, you have a long list of things. You're only allowed 2. You know, so Doug Balfour is going to report back on education. And you may want to stand up just so people can see it.
So our collective here, our coalition, decided to ignore all the requests from higher authorities to actually do what they were told and come up with 2 things. But we did talk about a lot of other stuff. And essentially, it really started, the conversation started with reflecting on education coalitions that we'd seen that didn't work and asking the question, why not? And then thinking around a couple of sort of 2 different coalitions that we'd seen that did work. One, Fair Education Alliance in the UK, which is 14 different organisations working together, and one in New York, with collaboration of not-for-profit, community, parents, and the New York school system working together. And that kind of like prompted us to start to think about, well, what is it that facilitates the successful, in our experience, the successful bringing together of coalitions both in education and elsewhere, and we started to talk about common vision, metrics. Gates Foundation came up a couple of times in terms of acting as using their funding power, but to try and facilitate collective action. Polio eradication came up as part of that. Recognizing how that we went back to an example in South Africa where the coalition failed because essentially the temptation to use the power of the coalition by one particular party made them the powerful, independent social entrepreneur, but basically wrecked all the trust. So the trust is actually very fragile. It's really, really easy to use your power and to lose that trust. If you abuse the trust, the whole thing sort of falls apart very, very quickly. And then mapping your organization essentially is really good to actually figure out, do we actually have people that are actually missing? You know, have we got lots of people that do the same thing, but what about the people that are doing different things? Awesome.
The hardest, I'm not sure which one this is, if it's environment or the food security, but we'll soon hear who's reporting back. I find the environment to be the hardest group to focus on building collaborative networks. Maybe you have the answer.
Well, we actually broke the rules as well and stuck to non-sector because we had some good friends from the other table.
Oh, okay.
But we focused on, we actually started off with a couple questions, just like where do you draw the lines of the system? So we get to that system level, at what level do you draw that line at? Within the country, within the department, within the continent, or potentially even the world? And we threw out a couple things that were important, like getting rid of the ego, not capitalizing letters, and really focusing on the cause. What is the problem? And we also had another question about the level of impact, or do we focus in on one community or focus in on one really important issue and help make a really big impact of that, but potentially smaller numbers, or go wide, go shallow, but have a huge number of people impacted, maybe not as high of a value. Alexandra mentioned systems they're always changing, and so trying to be adaptive and adjusting for that and redefining what the system is and mapping that out. And then finally, I think a really good point to end on, identifying who has power and then how does power move. I thought that was a really good point that I wouldn't give justice to continue talking about, but I think identifying that can have a big change in what you're doing.
Thank you. There's a new book coming out called The New Power by Henry Timms, and he wrote an article on Harvard Business Review. It's really interesting thinking about the new power networks that are coming up, more flat structures, so you may want to check that one out. This focused question, we also are finding that the simple measurable outcomes, what are those? It's not like I'm going to fix early childhood. Good luck on collaborating around that one. But you know, gee, I'm going to focus on Boston and 25,000 kids that are 3 to 5 years old, and all of a sudden you're saying, oh, now maybe I can do something over the next 5-year period, right? English, are you? You had a big group. Wow.
Okay, so we sort of started by going over what some of the major gaps were in the global health space, and global mental health was brought up, primary care was brought up, and just sort of a lack across the board of collaboration in those areas. So that sort of allowed us to narrow down like maybe what is missing to help foster those collaborations. Financing was another thing, just lack of collaboration on financing just through all of the mechanisms of global health. And then finally we sort of came to the agreement that lack of empowerment within partnerships and within collaborations can be really detrimental. So Jacques brought up a great point about his collaboration with Infund and saying that one of the reasons that it's so successful is because Infund has really empowered him and empowered his organization. And then lastly, overall there's not really an agreement on what the outcomes are. What are the outcomes that we're trying to achieve in global health and then in all of these sort of siloed sectors of global health?
Perfect. Now we're going to go quickly because we've got 5 minutes left on each group. So.
Yeah, this is, I would say, impossible. There were I need to stand up. Yes, so at this table there were, I think, a dozen different issues represented. We're the open table. And so maybe the only thing I can say that's useful here is that we began to talk about what collaborations will enable systems to communicate with themselves, and then what kinds of systems are required to activate engagement, and are they the same things or not. And we were particularly looking at filmmaking for social impact and other means of engaging youth for social impact, and are those really the same systems, developing empathy around the issues and then engaging action, and how do we form collaborations that do both of those things.
I like that. It's great points on communication strategies. And movement building, everybody on the next table. Movement building also, you know, skills and tools to start creating a movement that can support your collaboration.
Hey, so on the poverty table, which by the way we thought was the hardest issue, everyone probably thinks the same about theirs. Two points came across loud and clear. So first, it's good to have a single message that you can rally people around. So we thought the example of Malaria No More and Nothing But Nets was good, and perhaps if we could get people to rally in a similar way around some, at least some issue around poverty and then show progress, that would be better for the sector than everyone trying to pull in different directions. So that was one. And second, there's something to be said about the right message at the right time. So looking at the UK case, for example, there was a time when social investment became widely regarded as a good thing by government. That's when Big Society Capital was created, and the sector made a lot of progress. Maybe there's a similar time now to look at, say, poverty, the poverty premium that people are paying just for being poor, and these have wide appeal. So finding a framing that has a wide appeal in terms of policy, in terms of civil society, and capitalizing on that rather than a new idea that people aren't ready to adopt, that would be good as well. 2 more ideas I'll say in 10 seconds. One, that it's probably also good to think about positive language, so maybe prosperity instead of poverty, and also good to think about potentially involving more women in systems development, systems thinking. One participant said, you know, social entrepreneurship is seen as a male thing, very analytical and tactical. Maybe the system's being more of a women thing, and those would be the right people to bring in.
Nice. More Ellens. Is that what you're saying?
We were charged with immigration and refugees. First point is that this issue area albeit there are refugee crises that last for decades, this is often an issue that is a shorter-term crisis issue versus some of the intractable problems that are century-long problems that other tables are facing. In order to gain some leverage in this area, the table felt that it was important to create a common brand around the cause that can rise above any specific organization. And we used Syria as an example. But then, although a common brand was agreed to be useful, the question is, well, what stands behind that common brand for action that we can actually affect change? And there we felt maybe a central database of all organizations in this space of immigration and refugee who could be pulled together and create processes to pull together subsets of those organizations to address a specific problem.
Thank you. There's a lot of them, just examples. Sasha Chanoff at Refuge Points kind of work in that segment. I'm sure you guys are working with him, trying to pull together that discussion above the organization. So there are always somebody else working on this. If you don't know who they are, that's a really interesting task to go after. Nick?
So we're human rights, and we thought that was the easiest of all problems to
Of
solve.
course. Right.
So easy that we started talking about Brexit. But the reason we talked about Brexit is an example of a failure of a system, i.e. that there were 18 or so really well-funded pro-Remain organisations that had egos and disincentives to collaborate that led to a failure in part of the campaign to Remain. So there's an example of, you know, when systems don't work. The two lessons that we kind of came out of it, and I'm being very liberal in my interpretation of what we took out of this, but one is that often organisations are doing systems change without realising it. It's a bit like speaking prose. And the example of crisis action that I was involved in, Nick leads here in the UK, we were doing systems change 10 years ago. We didn't have the language, and in fact we didn't know how to articulate it, but the organisation was standing in the background, pulling together organisations working on conflict, with no ego to get them to collaborate around a single campaign, taking no publicity for itself and investing hugely in overcoming the transaction costs of building a campaign or a moment. So I think that's a very successful example, and now we know how to talk about it. And then Donna, I think, made a very practical observation that, you know, to build greater collaboration, we need some tools to share infrastructure, particularly for small organisations, and so some thinking around how do we just share basic resources among ourselves. Expertise on security awareness, IT expertise, comms expertise. I mentioned that Geneva Global, in a slightly different context, have been thinking of a fund of fund that had resources that various organisations could draw on.
Some call it a backbone.
Yeah, well that's it, and so a more conscious investment in that kind of infrastructure might be really useful to build collaboration.
That's great. And Crisis Action is a great example of somebody who is a system entrepreneur that didn't know it. And there's lots of them. So appreciate the time you all took coming together. There's a couple things. One is, if you want any of the slides or anything else, just give me your card, I'll send it to you. There's an article that literally just came out today, I think I told you about it, SSIR, that talks about the points that I've made here. It might help you communicate. It talks a lot about the Freedom Fund. It talks about what we're doing in education in the U.S., and Newcroft and a variety of others trying to use examples. So the conversation, I hope, will continue. There's lots of people that want to talk about this. So the more convenings coming together, join those. Doug's going to run at 3:15.
Yeah, 3 o'clock.
3 o'clock, a breakout, taking this conversation to another level.
Yeah, seminar room 5, which is just downstairs, and it's a small room, so I think it's like the first 12 that get there. We're going to do a clinic, and we're just going to talk about your issues.
So, he's one of the experts, so take advantage of that. With Ellen and Raj, I want to thank you for spending your time with us. While you all were talking, we were also noodling about, in his objective at the TED conference is action, date and action-focused dating. What do we call it?
Action-focused dating?
No, what do we call it?
Action-forcing event.
Action-forcing events.
Although I think we'll get more people to come if we say
action-forcing dating. But setting a date when you actually have to accomplish something. So actually using his H at the TED conference saying there's a lot of people that can unify around a common goal of CHWs by using that as an opportunity. It's what malaria did all the time with the General Assembly. It's what the Clinton Global Initiative did as well. So thinking about that in coalition building and collaborative building, using some things that I gotta get it done by, right? And so we're talking about how to do that and thinking about it.
I think someone just tweeted Action Focused Dating by Jeff.
Oh, great. Yeah. Please
Maybe
don't.
you both, Jeff.
Please don't. But thank you all. I appreciate it. Yeah.